All right, well, good afternoon and welcome to our August Veteran Town Hall. Thank you for joining us. We'll be monitoring questions in the chat and respond as soon as we can. So today's focus is, as always, the main campus at our Hines VA, as well as our Hoffman Estate CBOC. So first, I'd like to share some information about our main hospital, including commonly requested phone numbers, which are on your screen. Today's Veteran Town Hall also highlights our Hoffman Estates CBOC. Hoffman Estates provides primary care and specialty health services, including mental health, pharmacy, laboratory, and again, primary care. I'd also like to commend our Hoffman Estates CBOC for hosting a wonderful PACT Act event on August 5th. Various departments came together, including the Veterans Benefits Administration, as well as state and local agencies. 75 veterans were signed up for the PACT Act benefit at this event, and 9 veterans also applied for VA health care. If you'd like to sign up for the PACT Act benefits, please visit va.gov/PACT or continue to check our Facebook page for upcoming events. Last Friday, Hoffman Estates also threw a celebration for their patient, Army veteran Bernard Bluestein, who celebrated his 100th birthday. Happy birthday, sir. You'll find the Hoffman Estates CBOC contact information on your screen. If you have any specific questions for Hoffman Estates or Hines, please comment below or send a Facebook message to us and we'll get back to you as soon as possible. Couple of announcements. We're going to be having an August blood drive on August 18th, and we invite all visitors and patients of Hines to donate blood at this blood drive from 9:30 in the morning to 1:45 p.m. in the Hines Auditorium at our main campus. If you are O positive or O negative donor, please consider stopping by to help stabilize the blood supply and save veterans' lives. We're also going to be having a job fair this Saturday, August 19th from 9 a.m. to 1 p.m. at our main campus, with a special emphasis on hiring advanced medical support assistants, nursing assistants, healthcare technicians, and licensed practical nurses. The event again is going to be held in our auditorium. Please bring a current resume and 2 references. Veterans should also bring a DD-214 and service-connected disability letter if applicable. If you're unable to attend, you can send your resume to hinesishiring@va.gov. Additional job opportunities are listed on our USA Jobs website. And next, we're going to start off like we do all of our meetings with a safety story, and I'm going to ask one of our HRO leads, Mr. Beck, to please come up and present. Mr. Beck.
Thank you for that, Director. Hello, everybody. Our safety story today is in alignment with the HRO principles of sensitivity to operations, focus on frontline staff, and care processes. This story was communicated by an SCI North employee. An EMS staff consistently demonstrates going above and beyond every workday. He is accountable and is sensitive to the constantly changing needs of the unit. The staff is detail-oriented in the work that he does and always ensures that the environment of our staff and veterans is safe. He is kind and respectful to all. As a result of his attention to detail, the unit is kept clean and disinfected, allowing for the safety of our patients and staff. This concludes our safety story for today. I will be followed by Dr. Richardson, Chief of Medical, for medical updates. Thank you.
Thank you, Mr. Beck. This is Dr. Richardson, and I'm coming to you from an offsite. And so after my update, I will not be in there and will ask that any questions be placed in the chat, and we will definitely answer them. 2 things I wanted to update today about. First of all is our continuing issue with COVID, because as we see, there has been a slight increase over the summer in our COVID numbers. This has been seen in our Hines with a few more infections, but as we have recognized, there is a small increase nationally. At the moment, these have all been able to be treated with Paxlovid if necessary, and there have been no increase in Hines or in our veterans in the number of deaths in hospitalizations. The last important thing is to keep aware, because as the autumn and winter comes along, there is a possible FDA accepted booster vaccine, which may be available come September. The indications and the people who need this booster have not been determined yet, but certainly as soon as we have decided from the FDA and the CDC what's necessary, we will have that available for our veterans. But at the moment, prevention and recognition of the fact that there still is COVID infections around endemically is important. The second update that I want to give is to speak about our continued prevention as we go forward into the end of summer. There have been, as you know, continued disasters, that with fires, hurricanes, with flooding, and I want to encourage everyone to review again your emergency kits, your emergency contact numbers, and your packet of emergency medicine if necessary. So if something happened, you would be able to keep yourself and your family safe, and also be able to quickly gather your box of emergency medicines. We also say for the end of summer, remember that the heat is still important, and so hydration and management for people with conditions where they are not able to manage their heat and regulate their temperature, body temperature well, as well as people in the extremes of age, must also be careful. Thank you all very much for that end of my medical update. And I now want to introduce Ms. Harston to come and speak about our PACT Act.
Good afternoon. My name is Alice Harston. I am a legal administrative specialist at the VA Regional Office in Chicago, where we process claims for service connection, pension benefits, survivor benefits, and most recently for PACT Act claims. PACT Act claims are for veterans who have been exposed to toxic fumes, jet fuel, and things like that. Veterans who file a claim with us for PACT Act, we can file a claim on a 526EZ. If you have private medical, you can provide a form for us that is on a 4142. It is important to have a current diagnosis of the claim that you are filing. Also, you can come in and we can assist you at the regional office for that claim. Veterans can file an intent to file if they do not have a current diagnosis, which gives them time to work on getting a current diagnosis for those claims. If you want to come in and see us, you can schedule an appointment through va.gov/Vera or call the 800 number, which is 800-827-1000.
Hi, my name is Angela Chen, and I'm on the suicide prevention team here at Hines VA. September is Veteran Suicide Prevention Awareness Month. The theme is Don't Wait, Reach Out. Our team wanted to share some resources and events that will be taking place throughout the month. We will have a Veteran Art Affair on Thursday, September 28th from 10 to 2 in the Winter Gardens, outside behind buildings 12 and 13. There will be art on display from veterans and staff, therapy dogs from K9 Ministries, and other VA programs and community partners with tables during the event. Please come check it out. If you would like to submit a creative piece of art, such as a poem, drawing, a photograph, or a painting, along with an artist statement expressing thoughts and feelings about suicide and any message of hope and support. Please submit prior to September 22nd, and you can submit by contacting Cliff Edwards. His email is clifton.edwards@va.gov, or you can give him a call at 708-202-8212. The suicide prevention team will have outreach tables at all of the CBOCs throughout the month. We will be at LaSalle on the 5th, Aurora on the 7th, Oak Lawn on the 12th, Hoffman Estates on the 19th, Joliet on the 21st, and Kankakee on the 26th. We will have outreach tables where we will be providing gun locks, pillboxes, medication, disposal bags, VCL swag, and suicide prevention literature to veterans and staff. There are some great community events that the team has also partnered in and attending throughout the month. The Harley-Davidson ride on September 17th will start out of the Countryside Harley-Davidson and ride out to the Forgotten Warrior Memorial in Channahon. The DuPage Veterans Suicide Prevention Coalition Seminar will be Tuesday, September 12th from 9 to 3, and the Pritzker Military Museum will be presenting the Pritzker Vietnam Art Exhibit, Veterans Day, on September 23rd from 10 to 4. There will be more events to come. I wanted to end with a quick review of warning signs of suicide and what to do. So some of the warning signs include if you notice someone who is withdrawing from friends and family, changing personality, maybe more anxious or irritable, difficulty sleeping, losing interest in hobbies or work, giving away personal possessions, tying up loose ends, increased use of alcohol or substances, engaging in risky activities that are unusual for them, seeking access to firearms and medication. And then just briefly what you can do. So if a person is in immediate danger, you can call 911 and do not leave that person alone. If there is no immediate danger, start a conversation with the individual. Listen without judgment. Let them know that you are concerned about them. Ask the question, are you having thoughts of suicide? Let them express all their feelings and don't try to fix it in this one conversation. Assure that there is help available and help them get connected. And you can call the Veteran Crisis Line and also recommend that they get connected to mental health services. So I hope everyone has a good day.
Hello, my name is Marissa Reese, and I'm the Maternity Care Coordinator. Women is the fastest growing group of veterans using VA services. Many of the women veterans are of reproductive age and are having babies. Nationwide, the number of deliveries that the VA paid for has increased 14-fold since the year 2000. Here at Hines, the number of women veterans delivering has doubled in the last 10 years. Hines VA is holding our 2023 drive-through baby shower on Saturday, September 9th, 2023. The shower will take place at Crossman Circle by the Fisher House. We invited 30 expectant families to the shower. The invitations were sent to expectant mothers who are getting maternity benefits from Hines VA and some male veterans whose partners are expecting from the M2 VA service. We have a wonderful team of baby shower committee members who have been working hard to make the drive-through baby shower a success. We are looking forward to the big day. And I'd like to introduce Ms. Beverly Fitch. Thank you.
Hi, my name is Beverly Fitch. I'm a volunteer service specialist for the Center of Development and Civic Engagement, and I want to talk about our joint Women Veterans Stand Down between Hines and Jesse Brown's VA. It'll take place on Friday, September 8th from 9 a.m. to 4 p.m. at Malcolm X College in rooms 1102 and 1104. As a female veteran, I'm very excited about this because this will be the first stand down that has something to do with our female veterans. We'll have a lot of speakers. Most of our speakers will be female veterans. We'll have a lot of wellness activities like hula hoop, Rike. We'll be doing line dances. There will be resource vendors, and a lot of our resource vendors are female veterans as well. And I'm really excited because the lunch will be served by a female veteran. There'll be gifts and giveaways. So you can register on Eventbrite, and we will be taking walk-ins. And please be sure to tell other female veterans about this event. I would like to introduce Megan McVeigh from Home-Based Primary Care. She's a program director.
Hello, I'm Megan McVeigh. I'm the director for Home-Based Primary Care, and this is my colleague Christina Captain, who is our nurse clinical coordinator in the Home-Based Primary Care program. Today we're going to talk to you a little bit about what home-based primary care is and how to enroll in our program.
Home-based primary care is a primary care clinic with the VA that provides primary care services to veterans in their home when visits to the clinic are no longer possible or are not meeting the veteran's needs. We have team members who work out of Hines and all of the outpatient clinics to serve veterans across the Chicagoland area. The HBPC team will work with you and your family to meet your medical, mobility, and emotional needs to promote your best quality of life and to keep you out of the hospital and at home where you want to be. Who is HBPC for? HBPC serves veterans with medical problems who would benefit from team-based support. If you are experiencing frequent hospital stays or are finding it hard to keep up with frequent clinic visits or lab work, HBPC may be a good fit for you. The team will work with you and your family to find a care plan to meet your needs. You will learn what symptoms to report to your HBPC team to find problems early before they lead to an emergency room visit or hospital stay.
If considering home-based primary care and debating if this is right for you, it's really important to understand that home-based primary care takes a team approach. On your screen, you can see all of the different disciplines that are involved in our home-based primary care team. We have physicians, we have nurse case managers, social workers, rehabilitative therapists, that's like physical therapy, clinical pharmacists, registered dietitians, psychology, and psychiatric care. All of our patients are staffed every 90 days, which means that we talk about their care as a team every 90 days so that we're constantly working to provide the best quality of care for you. If you are interested in enrolling in our program, it's best to talk to your VA primary care provider about the program. And you can always call us directly. That number to call us is 708-202-2051. And I put my own number on here. So if you're having trouble getting into our program or have any questions, can't get a hold of us, you can reach my VA cell directly at 708-378-1887. So thank you very much, and please consider home-based primary care if you experience those symptoms like Christina was talking about. Next, we'll introduce Erin with Relationship Health and Safety Screen Clinical Reminders.
Good afternoon. I'm Erin Hanrahan. I'm the Intimate Partner Violence Assistance Program Coordinator here at Hines. For the next few moments, if anything that I share is upsetting or triggering, please feel free to reach out to me at 708-202-7243 or our National Domestic Violence Hotline at 1-800-799-7233. And again, please remember to take care of yourself. The IFVAP program is a comprehensive program that takes a person-centered, trauma-informed, and veteran-centric and recovery-oriented approach to providing education, resources, engage in prevention, enhancing safety, and reducing risk and promoting healthy relationships for veterans, their partners, and VA employees. The Department of Veteran Affairs recognizes that intimate partner violence is a serious yet preventable health concern among veteran population. IPV is strongly associated with other public health, including suicide, homicide, homelessness, and women health concerns, and is a significant problem for our veterans and partners. Briefly, I want to define that intimate partner violence is any behavior including, but not limited to, physical or sexual violence, stalking, or psychological aggression that can happen by a current or former partner, and it can result on a continuum of frequency and severity, and also could happen among hetero or same-sex relationships and does not require sexual intimacy or living together. Because relationships are essential aspects of overall health, it's vital that relationship wellness be understood and promoted. When relationships are unhealthy and negative aspects can last a lifetime, it's critically important that those impacted by unsafe or unhealthy relationships have support and heal to grow. The ITVAP program is committed to relationship wellness and promoting services for all that are impacted by the use or experience of IPV. I'm here today to introduce our Relationship Health and Safety Screen, which is going to be a formal clinical reminder that is going to be launching. Why do we want to screen? We've learned from our veterans, there's been several focus groups, and also as an organization, we believe that it's important as a healthcare system that we ask veterans about their relationship health and safety to improve their physical, mental health, and overall well-being. Eventually, all veterans, you can see on the slide in front of you that eventually all veterans enrolled in the healthcare will be screened. However, consistent with our current VHA ITVAP policy, it is mandated that every facility activate the clinical reminder and provide annual screening for all women veterans who are 47 years of age and under. Screening will be conducted annually, and resources and referrals will be provided to support your health and safety and well-being. ITVAP is committed to training all VA staff to administer the clinical reminder with dignity, respect, encouragement, and help. Please reach out to myself or to your mental health or medical provider with any questions or concerns. Again, I can be reached at 708-202-7243. You can also go to the National ITVAP website for more information. Please remember that you're not alone and help is available. And for closing remarks, I want to bring back up Mr. Doling. Thank you.
All right, thank you to all of our presenters. A lot of great information. I just have a couple of closing statements. First, I want to let everyone know last month we had our triennial visit by the Office of Inspector General. And not to my surprise, they found staff that was highly engaged, cooperative, and collaborative. Few tips that we got for improvement, but overall they were very, very pleased with our processes and outcomes. We are expecting the end of this month the results of our annual all-employees survey. I'm happy to report that we had the highest participation rate in the survey that we've ever had at Hines. We're looking forward to the results and implementing changes that will lead to increased staff satisfaction and their psychological safety. With that, I'm very proud to announce that our HRO team, who's leading us on our psychological safety journey, Mr. Beck and his three peers, Ms. Percy, Mr. Marchese, and Mr. Butisoff, were recently highlighted nationally for their work on our tiered huddle systems that just celebrated their one-year anniversary. This was put in place to enhance staff real-time knowledge and ability to report any process concerns or issues. And over that time, from last year to now, we've had a 500% increase in reporting from our frontline staff. So kudos to Mr. Beck and his team. And lastly, this week and last week, we've been hearing from staff making innovative presentations to the executive leadership team. We have 12 members of Team Hines who have presented ideas from virtual painting classes for veteran caregivers to a mobile unit swallowing study cart that will go to our C-Box and other areas in the community. With their pitches, they're hoping for the executive leadership team's support to move forward with their ideas. And I can tell you we've been very impressed with the creativity and enthusiasm, and I'm certain that all 12 are going to be approved. So please list any questions you have in the chat. Again, we will get back to you as soon as possible. Or if it's a matter of confidentiality or personal matter, please email us through the Facebook site. And again, we'll get back to you as soon as possible. Our next Veteran Town Hall is October 11th. We look forward to continuing to serve all of you. Thank you for your service and have a wonderful day.